I'll go over sort of my thoughts on how you sort of what on the posterior. So there are two main categories of teeth in the posterior. What are they? Premolars and molars, right? All right. My presentation today will assume that you can tell the difference between a premolar and a molar. So if you were to boil it down to one main type of characteristic on the crown of the tooth, what's the difference between premolars and molars? It's really quick. What's the one thing? Yeah, I'd say cusps, number of cusps, right? So if it has 4 or more, it's a molar. If it has less than 4, it's a premolar, okay? That's it. So can I trust you to at least know that? All right, let's do this. Let's start with premolars. Okay. So let's say you got a tooth in front of you, and you know that it's a premolar of some sort. The first thing is it maxillary or mandibular? Maxillary or mandibular. The main thing that I look at for maxillary versus mandibular is the cusps, and it's like the relative shape and height of them, okay? So on a maxillary premolar, it doesn't matter whether it's the first or second, you've got 2 cusps that are relatively pointy, and they're never going to be exactly the same height, but they're both pretty respectable in their heights, okay? They've got some height to them, okay? So that would be max. And when you look at it, the amount of buccal to lingual sort of real estate that they take up, it's not, although one is bigger than the other, it's not like one is overwhelmingly bigger than the other, okay? So this is max, okay? On the mandibular, you always have one buccal cusp, and then you have 1 or 2 lingual cusps, and that buccal cusp is clearly bigger than the lingual whatevers, okay? Okay, so this is mandibular. Okay, so maxillary, you've got these 2 pointy-ish, what's the deal with this? Cusps that are, you know, they're not, again, one's gonna be bigger than the other, but it's not, they're gonna be kind of similar. With the mandibular, clearly the buccal cusp is bigger. Is that cool? And that goes for first or second of both of those, okay? Okay, so let's focus on the maxillary now. Whatever. All right. So on the maxillary, we had, remember I told you last time that on the tooth ID, you don't look at the roots. There's only one exception, you can look at the roots. This is the exception. In fact, you will need to look at the roots to tell the difference, okay? So in the maxillary premolars, you have our permission to look at the roots, okay? All right, so you got, turn these guys sideways, look at it from a proximal view. If it's a split root that splits into 2, then it's a first, okay? If it is uniform all the way down to the end, it's a second. That's that. Okay, and Dr. Fry, just to confirm, you know, in their premolar lecture, they learned about the whole spectrum of how it could split. Is when they look at their jars, if they see any split at all, are they going to consider that a first? So you see any furcation at all on that root into 2 little tips at any point, consider that a first. If it's just 1 tip at the end, then consider it a second, okay? All right. So now once you have that, then it's tell left from right. So from this, you're going to go back to the occlusal view. things on the mesial are going to be a little bit straighter. Things are going to be more curved on the distal, especially on this lingual side. The lingual cusp is going to be, if you were to judge it being either to the left, whatever side it's sort of leaning towards, that's going to be sort of the mesial, okay? And this is sort of a subtle thing, but it becomes pretty obvious after you look at enough of them, okay? So that's left and right, okay? So that's the maxillary premolars. You cool with that?
I'll tell you my hint on that.
Can I see the mesial marginal? Can I always compare and can I use them with superficial as well?
Mesial marginal groove, what this is saying, are we saying?
Yeah, I marked an X on that lingual cusp so you can sort of see that it is sort of deviating to one side, okay? All right. Oh yeah, and I guess I'm cool with people recording me. I would just ask as a courtesy to me, just ask me before you do it. Yeah, and before you share it with the rest of the world, also ask me, okay? So just so I know how much of these out there, okay? Thanks.
Can I deposit?
So those of you who are recording, just talk to me afterwards so I can know what's going on. Okay, all right. Are we cool with maxillary? It sounds all fine and dandy, you gotta try it out, okay? All right, so go to mandibular. Mandibular, so once you know this in mandibular, let's split, and these teeth are much more different from each other. So again, the maxillary premolars are the only ones you use the roots on, okay? That's the only exception. From there, we're back to normal, just look at the crown, okay? Okay, so mandibular. Okay, so there are a number of things about the mandibulars and the way you tell them apart is going to be the occlusal view. Okay, so this is an occlusal view. The number one thing that will pop out at you once you get used to looking at this is the number of cusps. For the purposes of this tooth ID, the first, and first always, has two cusps, right? It has one buccal and one lingual. Okay, so 1, 2. For the purpose of the tooth ID exam, Dr. Fry is only going to use Y-shaped second premolars. So there'll be 3 cusps on that one. So the Y-type second has 1, 2, 3 cusps. Okay. You should also get a hint from the overall sort of outline. The occlusal outline is described in your lecture is sort of diamond shaped, right? By contrast, the second is more squarish, or you can make the argument for a pentagon because of that prominent buccal ridge of the buccal cusp, okay? But is that, I mean, they're pretty different from one another, okay? And the first premolar, because of its really, really prominent buccal cusp and barely there lingual cusp, and because of the angulation of, it's turned a little bit like 45 degrees towards the lingual, it looks like a canine canine wannabe, okay? So it's easy sometimes to get these confused with canine, especially if it's pretty pointy in that buccal cusp. The second premolar, its occlusal surface is more level, and especially with those 3 cusps, it really does look like that mini molar. So you can really think of these premolars as transition teeth. That lower first premolar is more like a canine, and the lower second is more like a molar, okay? So now let's tell left from right. So for the first, again, the occlusal view is the key. Hopefully I can do this. Get nervous every year. I'm exaggerating this. Okay. Okay, so this is the occlusal view, this is buccal, lingual, and so the deal with this one is that when you look at it from the occlusal view, and you're looking at the sort of lingual half of it, and in fact you're looking sort of at the lingual line angle, so the mesiolingual and the distal lingual line angle, on most specimens, it looks like someone took a knife and just sliced off that mesiolingual corner, okay? The distal, by contrast, looks sort of rounded, okay? But it's pretty, I mean, this is exaggerated. I mean, it's not gonna look like hard like that, but it's pretty like reduced on that mesiolingual. And the added bonus is this mesiolingual developmental groove that also comes out towards that sort of chopped off edge, okay? So you've got two hints. You've got that sliced off mesiolingual corner, and you've got that mesiolingual developmental groove right there, okay? Bam. So now you know medial from distal, now you know left from right, okay? Everyone cool with that? All right. For the second, again, the secret is the occlusal view. So you got that Y-type sort of situation there, and you've got your one buccal cusp, and you've got your two lingual cusps. Between the two lingual cusps, you know that the mesiolingual cusp is the larger of the two, correct? So whichever one of those two lingual cusps is bigger is your mesiolingual, okay? So in this case, it's this guy. So now you know mesial and lingual. Now you know left from right. Does that make sense to everyone? And that's it, that's premolars. So much easier than canines. You should not be guessing. This should not be, you shouldn't be like, oh, I don't know what this is. You should know it, okay? I can't make it any easier than that. Okay, premolars. I'll leave this up here. You can do whatever you want with it. Let's move on to molars.